Hello everybody, I am Dr. Rahul Yadav, a pediatrician. Today we will be discussing a very important topic which are home remedies related to children regarding cold. So now as you all know, cold and chest congestion is very common among children and it might occur as many times as 6 to 7 times every year. So this is a pretty much normal for each and every kid. If you have a child, you would have definitely experienced the agony of the child having cold and chest congestion during any time during his childhood. So, first of all, I would like to give you one piece of warning. A child with cold and chest congestion having wheezing, which might be a increased intensity of sounds when the child is breathing in or out, signs of respiratory distress, which might be increased work of breathing, increased rate of breathing, or difficulty in even uttering normal words. In that scenario, you have to rush the child immediately to the nearest doctor or to an emergency or hospital near your home. Another scenario would be if your child is suffering from asthma. In that scenario, I would advise you to take proper precautions and follow the instructions of your doctor regarding inhalers or nebulizers before trying any of the following home remedies. So, what actually can the home remedies treat? Home remedies can treat a child suffering from cold with no signs of respiratory distress with a few gurgling sounds while breathing. Is it actually useful? Actually, yes. Home remedies might even be better than medicines in common day-to-day cold and chest congestion. So what are the home remedies that we can do? One is, the easiest would be to start honey. Honey has natural immunoboosters which you can easily start. Can it be given to each and every child? Yes, it can be given to each and every child, but do not use it for any child less than 1 year of age. The reason behind it would be because of the incidence of botulinum toxin in the honey, which can be very deadly to a child less than 1 year of age. You can even mix the honey with a little bit of lemon juice or ginger paste to make the child accept the honey well. With honey, you have to just take a precaution in a case of a diabetic child. In that, you should not be over giving the honey. But in an otherwise child, you can give the honey as many times as you want, maybe even 1 TSF every 3 to 4 hours also. Another home remedy that you can try out is humidification. Humidification can be done by either a cold humidification or warm humidification. Cold humidification is safer. Warm humidification is by the steam. Steam is very dangerous in a child as it can lead to burns also. So the better way is to close all the doors and windows of the house and just put the steamer in one corner of the room and let the whole room be humidified instead of just the child. That will help the child a lot. Another thing that you can do is to use normal saline nasal drops to keep the nostrils of the child clean. As the child's nose remains clean, the child will be able to breathe easier and would be much more comfortable and would even respond better to other medicines. You have to remember that colds in a child is 99% because of viruses. In that, it generally takes 7 to 10 days for the treatment to have its place, and it's a natural course of the disease. So you have to wait that much of time, you have to be patient. These are the common remedies that you can do which will alleviate most of the symptoms that your child would be suffering from. If you have any other queries regarding this or any other issues regarding to pediatrics, you can contact me at lybrate.com.